Did you know that a simple vitamin could be the key to addressing a common yet often overlooked sign of kidney issues? Imagine discovering a solution within your daily diet that could not only protect your kidneys, but also potentially repair existing damage. Maintaining our kidney health is crucial for our overall well-being, yet many of us are unaware of hidden risks, such as excessive protein in our urine. This condition indicates that our kidneys might not be functioning properly. It can be difficult to detect because the symptoms aren't always obvious, but it can significantly impact our health. Kidney stones, also known as nephrolithiasis or renal calculi, are hard deposits made of minerals and salts that form inside your kidneys. They develop when your urine becomes concentrated, allowing minerals to crystallize and stick together. Passing kidney stones can be quite painful, but they usually don't cause permanent damage if they're recognized in a timely manner. Symptoms of kidney stones. Kidney stones can present with a variety of symptoms. Let's delve into the primary symptoms you might experience if you have a kidney stone. 1. Pain in the back, belly, or side. The pain from a kidney stone is often described as one of the most severe types imaginable. This pain, known as renal colic, usually starts suddenly when a stone moves into the ureter, causing blockage and increased pressure in the kidney. The pain typically begins in the back or side, below the ribs, and may radiate to the lower abdomen and groin. Sarah, a 35-year-old teacher, was jolted awake one night by intense pain in her lower back. The pain was so severe that she could hardly move. As it radiated to her belly and groin, she realized something was seriously wrong. At the emergency room, she was diagnosed with a kidney stone. Kidney stones cause pain when they move into the ureter, the narrow tube connecting the kidney and bladder. The blockage leads to increased pressure and spasms, resulting in severe, fluctuating pain that can last for minutes to hours. 2. Pain or burning. During urination. As the stone moves down the ureter closer to the bladder, it can cause pain or a burning sensation during urination. Mike, a 40-year-old accountant, noticed a sharp pain every time he urinated. Initially, he dismissed it as a urinary tract infection, but the pain persisted and worsened. Medical tests revealed a small kidney stone lodged at the junction of his ureter and bladder. When a kidney stone reaches the ureter-bladder junction, it irritates the bladder lining, causing sharp or burning pain during urination. This symptom is often misattributed to infections, making it crucial to seek medical advice for an accurate diagnosis. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment great to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. 3. Frequent urination. An increased urge to urinate more frequently than usual can be a sign of a kidney stone progressing through the urinary tract. Emily, a 28-year-old nurse, found herself needing to urinate every hour. Initially, she thought it was due to increased water intake, but the frequency didn't match her fluid consumption. After experiencing sharp pains during urination, she sought medical help and was diagnosed with a kidney stone. As a kidney stone moves lower in the urinary tract, it can irritate the bladder, increasing the urge to urinate. This frequent urination is the body's response to the stone's presence and the irritation it causes. 4. Blood in the urine. Blood in the urine, or hematuria, is a common symptom of kidney stones. The blood can be pink, red, or brown. John, a 50-year-old construction worker, noticed his urine had a pinkish tint. Initially, he ignored it, attributing it to something he ate. When the color persisted, he visited his doctor, who found a kidney stone through imaging tests. Healthy kidneys do not allow blood cells to pass into the urine. A kidney stone can scrape against the delicate lining of the urinary tract, causing bleeding that manifests as blood in the urine. 5. Cloudy or smelly urine. Healthy urine is typically clear with a mild odor. Cloudy or foul-smelling urine can indicate an infection in the kidneys or urinary tract, often associated with kidney stones. Laura, a 45-year-old librarian, noticed her urine was cloudy and had a strong odor. Concerned about a possible infection, she visited her healthcare provider. Tests revealed she had a kidney stone and a concurrent urinary tract infection. Kidney stones can create blockages that lead to urinary tract infections, UTIs. The bacteria from these infections can cause urine to become cloudy and develop a strong odor. It's essential to address these symptoms promptly to prevent complications. 6. Small amounts of urine. Producing only small amounts of urine at a time can be a sign that a large kidney stone is obstructing the ureter. This blockage can slow or stop the flow of urine, posing a significant health risk. David, a 55-year-old mechanic, found that despite the urge to urinate frequently, he was only passing small amounts of urine. This continued for several days until he experienced severe pain and sought emergency medical care. Doctors discovered a large kidney stone blocking his ureter. A large kidney stone can obstruct the ureter, preventing urine from flowing normally. This blockage can lead to decreased urine output and requires immediate medical attention to avoid kidney damage. 7. Nausea and vomiting. Nausea and vomiting are common symptoms among individuals with kidney stones. These symptoms occur due to the shared nerve connections between the kidneys and the gastrointestinal tract. Rachel, a 30-year-old chef, began experiencing severe nausea and vomiting along with abdominal pain. Initially, she thought it was a stomach bug, but when the symptoms persisted, she sought medical advice. An ultrasound revealed she had a kidney stone. The kidneys and gastrointestinal tract share nerve pathways. When a kidney stone causes significant pain, it can stimulate these nerves, leading to nausea and vomiting. These symptoms are the body's response to the severe discomfort caused by the stone. 8. Fever and chills. Fever and chills are signs of an infection in the kidneys or another part of the urinary tract. This can be a serious complication of a kidney stone, requiring immediate medical attention. Tom, a 60-year-old retiree, developed a high fever and chills along with severe back pain. His doctor immediately suspected a kidney infection and performed tests that confirmed a kidney stone with a concurrent infection. Tom was hospitalized for treatment to prevent further complications. A kidney stone can cause a urinary tract infection, leading to fever and chills. This infection can spread and become severe if not treated promptly. Fever combined with kidney pain is a medical emergency that needs immediate attention. 9. Persistent pain. Persistent pain that does not subside with medication can indicate a kidney stone that is not passing on its own. This type of pain often requires medical intervention to alleviate and remove the stone. Ben, a 48-year-old lawyer, experienced ongoing pain despite taking over-the-counter pain relievers. His doctor recommended a CT scan, which revealed a large kidney stone that required surgical removal. Ben's pain significantly improved after the procedure. Persistent pain suggests that a kidney stone may be too large to pass through the urinary tract on its own. Medical treatments, such as shockwave lithotripsy or surgical removal, may be necessary to alleviate the pain and remove the stone. 10. Loss of appetite and weight loss. A decreased appetite and unexplained weight loss can be indirect symptoms of kidney stones, often due to the associated pain and nausea. Susan, a 40-year-old writer, noticed she was losing weight and had little interest in food. She also experienced intermittent pain and nausea. After visiting her healthcare provider, she was diagnosed with a kidney stone. Addressing the kidney stone helped her regain her appetite and stabilize her weight. The pain and nausea associated with kidney stones can lead to a reduced appetite and weight loss. Managing the underlying kidney stone can help alleviate these symptoms and improve overall health. Steps to lower your risk of kidney stones. Preventing kidney stones involves several lifestyle and dietary changes. Here are some steps you can take to lower your risk. 1. Stay hydrated drinking. Plenty of water is one of the most effective ways to prevent kidney stones. Staying hydrated helps dilute the substances in urine that can form stones. Mark, a 50-year-old athlete, made it a habit to drink at least 8 glasses of water a day. After experiencing a kidney stone, he increased his water intake and added lemon juice to his water to help prevent future stones. This simple change significantly reduced his risk. Adequate hydration helps dilute the concentration of minerals and salts in urine, reducing the likelihood of stone formation. Aim for at least 2 to 3 liters of water per day, and consider adding lemon or lime juice to help prevent stones. 2. Maintain a healthy diet. A balanced diet that is low in oxalates, sodium, and animal protein can help prevent kidney stones. Incorporate plenty of fruits, vegetables, and whole grains into your diet. Lisa, a 35-year-old nurse, adjusted her diet after her first kidney stone. She reduced her intake of high oxalate foods like spinach and nuts, and increased her consumption of fruits and vegetables. This dietary change helped her prevent further kidney stones. Certain foods high in oxalates, such as spinach, nuts, and chocolate, can contribute to kidney stone formation. Reducing intake of these foods and increasing consumption of calcium-rich foods can help prevent stones. Additionally, limiting sodium and animal protein can reduce the risk. 3. Monitor your sodium intake. Excessive sodium intake can increase the risk of kidney stones by causing calcium to build up in the urine. Aim to consume no more than 2,300 milligrams of sodium per day. James, a 45-year-old accountant, used to consume a high-sodium diet. After experiencing a kidney stone, he started reading food labels and reducing his sodium intake. This change helped him prevent additional stones. High sodium intake can cause the kidneys to excrete more calcium into the urine, increasing the risk of stone formation. Reducing sodium intake helps lower this risk and supports overall kidney health. 4. Limit animal protein. Eating too much animal protein can increase the risk of kidney stones. Consider reducing your intake of red meat, poultry, and seafood. Karen, a 40-year-old chef, frequently ate red meat and seafood. After being diagnosed with kidney stones, she reduced her animal protein intake and incorporated more plant-based proteins into her diet. This change helped her avoid future stones. Animal protein increases the level of uric acid and reduces the level of citrate, both of which can contribute to kidney stones. Reducing animal protein intake and increasing plant-based proteins can help prevent stone formation. 5. Increase calcium intake. Contrary to popular belief, reducing dietary calcium can actually increase the risk of kidney stones. Ensure you get enough calcium through your diet to prevent stones. Nancy, a 55-year-old teacher, initially reduced her calcium intake after her first kidney stone. Her doctor advised her to increase her dietary calcium instead. By consuming more dairy products and leafy greens, Nancy reduced her risk of future stones. Adequate calcium intake binds with oxalates in the gut, preventing them from being absorbed into the bloodstream and forming stones. Aim for 1,200 milligrams of calcium per day through diet, rather than supplements. 6. Avoid high oxalate foods. Foods high in oxalates can contribute to kidney stone formation. Limit your intake of high oxalate foods such as spinach, beets, and nuts. Tom, a 30-year-old engineer, loved eating spinach salads and nuts. After experiencing a kidney stone, he reduced his intake of these high oxalate foods and replaced them with lower oxalate options like cauliflower and apples. This change helped him prevent future stones. Oxalates combined with calcium in the urine, forming calcium oxalate stones. Limiting high oxalate foods and pairing them with calcium-rich foods can help reduce the risk of stone formation. 7. Avoid excessive vitamin C supplements. High doses of vitamin C supplements can increase the risk of kidney stones. Stick to the recommended daily allowance of vitamin C to avoid this risk. David, a 60-year-old retiree, used to take high doses of vitamin C supplements to boost his immune system. After developing a kidney stone, his doctor advised him to reduce his vitamin C intake. By sticking to the recommended daily allowance, David was able to prevent further stones. Vitamin C can be metabolized into oxalate, increasing the risk of kidney stones. Stick to the recommended daily allowance of 90 milligrams for men and 75 milligrams for women to avoid excessive intake. 8. Manage medical conditions. Certain medical conditions such as diabetes and high blood pressure can increase the risk of kidney stones. Properly managing these conditions can help prevent stones. Laura, a 50-year-old teacher with diabetes, worked with her doctor to manage her blood sugar levels effectively. By keeping her diabetes under control, she was able to reduce her risk of developing kidney stones. Medical conditions like diabetes and high blood pressure can affect kidney function and increase the risk of stone formation. Proper management of these conditions through medication, diet, and lifestyle changes can help prevent stones. 9. Consult a healthcare provider. If you have a history of kidney stones or are at high risk, consult a healthcare provider for personalized advice and monitoring. They can recommend dietary changes, medications, and lifestyle adjustments to help prevent stones. Emily, a 35-year-old graphic designer, had a family history of kidney stones. She regularly consulted her healthcare provider, who monitored her kidney health and provided personalized recommendations. This proactive approach helped Emily prevent stones and maintain good kidney health. Regular consultations with a healthcare provider can help you stay informed about your kidney health and take proactive steps to prevent stones. They can provide personalized advice based on your medical history and risk factors. Conclusion: kidney stones are a common but painful condition that can significantly impact your quality of life. Recognizing the symptoms and understanding the risk factors are crucial for early detection and prevention. By staying hydrated, maintaining a healthy diet, monitoring sodium and animal protein intake, and consulting a healthcare provider, you can reduce your risk of developing kidney stones. Remember, proactive steps and informed choices are key to maintaining good kidney health. If you experience any symptoms of kidney stones, seek medical attention promptly to avoid complications. A vitamin's role in kidney health. Now, let's return to our initial discussion on the surprising role a simple vitamin can play in addressing kidney health, specifically in tackling the issue of excess protein in the urine, also known as proteinuria. Understanding proteinuria. Proteinuria indicates that your kidneys are not filtering your blood effectively, allowing essential proteins to escape into the urine. This condition can be a sign of kidney damage and is often associated with diseases like diabetes and hypertension. When kidneys are damaged, they may fail to retain important proteins like albumin, leading to their presence in the urine. John, a 60-year-old man with diabetes, noticed frothy urine and swelling in his ankles. His doctor diagnosed him with proteinuria, a common complication of poorly managed diabetes. By adjusting his medication and diet, John managed to reduce protein levels in his urine and improve his kidney function. Proteinuria often starts silently, without obvious symptoms. As it progresses, signs like foamy urine and swelling can appear. Addressing proteinuria early is crucial to prevent further kidney damage and complications. The role of vitamin D in kidney health. Vitamin D, known as the sunshine vitamin, plays a crucial role in maintaining overall health, including supporting kidney function. It helps regulate the renin-angiotensin-aldosterone system, RAAS, which controls blood pressure and fluid balance, both critical for kidney health. Vitamin D's anti-inflammatory properties also help reduce kidney inflammation, a common issue in chronic kidney disease, CKD. Maria, a 45-year-old woman with CKD, experienced frequent urinary tract infections and worsening kidney function. Her doctor recommended vitamin D supplements, which helped reduce inflammation and improve her kidney function over time. Vitamin D helps reduce inflammation and modulate the RAAS, thereby protecting the kidneys from damage and improving overall kidney health. Adequate vitamin D levels can be achieved through sunlight exposure, diet, and supplements. Dietary sources of vitamin D. To harness the benefits of vitamin D for kidney health, it's essential to incorporate vitamin D-rich foods into your diet. Here are some excellent sources. Fatty fish. Salmon, mackerel, and sardines are rich in vitamin D. Including these in your diet can significantly boost your vitamin D levels. Laura, a 50-year-old teacher, included salmon in her weekly diet after her doctor advised her to increase her vitamin D intake. This change helped improve her kidney function and overall health. Fatty fish are among the best natural sources of vitamin D. Regular consumption can help maintain adequate vitamin D levels, supporting kidney health and overall well-being. Fortified foods. Many foods, such as milk, orange juice, and cereals, are fortified with vitamin D. Including these in your diet can help prevent deficiency. David, a 60-year-old retiree, started drinking fortified orange juice daily. This simple addition to his diet helped increase his vitamin D levels and support his kidney health. Fortified foods provide an accessible way to increase vitamin D intake, especially for those with limited sun exposure. They can help ensure adequate levels to support various bodily functions, including kidney health. Mushrooms. Certain mushrooms exposed to sunlight are also good sources of vitamin D. Including these in your meals can contribute to your daily vitamin D intake. Karen, a 40-year-old chef, began adding sun-exposed mushrooms to her dishes. This not only enhanced the flavor, but also helped her maintain healthy vitamin D levels. Mushrooms can produce vitamin D2 when exposed to sunlight. While vitamin D2 is less potent than D3, it still contributes to overall vitamin D intake and supports health. The importance of supplementation. For individuals who cannot get enough vitamin D from sunlight and diet alone, supplements may be necessary. It's crucial to consult with a healthcare provider to determine the appropriate dosage based on individual needs and health conditions. Tom, a 70-year-old man with limited sun exposure, was advised by his doctor to take vitamin D supplements. Regular monitoring ensured he maintained optimal vitamin D levels, supporting his kidney health. Vitamin D supplements can help individuals achieve adequate levels, especially those with limited sun exposure or dietary restrictions. Proper supplementation can prevent deficiency and support various health functions, including kidney health. Curious about the foods that can supercharge your life and fuel your body with vitality? Subscribe to my YouTube channel, Home Nutrit, and join me on a quest to explore the wonders of nutrition for a healthier, happier you. If you like this video, comment great to encourage us. By the way, we have a special offer for you. If you want to dive even deeper into understanding kidney health, we've got something just for you. Check out the link in the description below for a free, in-depth ebook on kidney health. This comprehensive guide covers everything you need to know about maintaining healthy kidneys and preventing kidney disease. Don't miss out on this valuable resource. Your kidneys will thank you. Maintaining optimal vitamin D levels is essential for supporting kidney health and preventing conditions like proteinuria. Through dietary sources, supplements, and lifestyle adjustments, you can ensure adequate vitamin D intake. By understanding the role of vitamin D and making informed choices, you can significantly improve your kidney health and overall well-being. Regular consultations with healthcare providers are vital to tailor these recommendations to your individual health needs and conditions. If you found this information helpful, please like, comment, and subscribe for more health tips and advice.